Most men hear the phrase prostate massage and immediately assume it belongs in internet rumors, adult content, or something that is not medically relevant. But here is the truth that surprises many people. The prostate is a real, medically important gland, and it is sometimes involved in clinical procedures used by urologists for very specific health reasons. And yet, most of what people believe about it online is either exaggerated, misunderstood, or completely wrong. Some think it's purely sexual, some think it's dangerous, some think it's a DIY health hack you can just figure out on your own. But in medicine, none of those assumptions are correct. So today, I want to break this down clearly. What it actually is, when it is used, why doctors are extremely careful with it, and what men should never attempt without medical guidance. My name is Dr. James, and I've been a practicing urologist for over 12 years, helping men understand sensitive health topics without fear, confusion, or misinformation. Before we begin, if you find this helpful, take a moment to subscribe to the channel because we break down men's health in a way that is simple, honest, and medically accurate. Now let's clear the confusion. One of the biggest misconceptions online is that prostate manipulation is a casual wellness practice that can be done without context or training. In reality, the prostate is a small gland located deep within the male pelvic region, and its role is primarily related to reproductive fluid production and urinary system interaction. Because of its location and sensitivity, any direct evaluation of this gland in a clinical setting is done under strict medical conditions. What people online often call massage is not a wellness routine in medicine. In clinical practice, urologists focus on diagnostic evaluation of symptoms, assessment of inflammation or enlargement, investigation of urinary changes, and in rare cases, assisting with medical fluid expression for testing. That is very different from the casual or recreational interpretation seen online. So the first correction is simple. This is not a DIY practice. It is a medical context procedure that requires training, understanding, and sterile conditions. Why the prostate gets so much attention? The prostate becomes a topic of confusion because it sits at the intersection of three important systems: urinary function, reproductive health, and hormonal changes with age. This means that when something changes in the prostate, men may notice differences in urinary flow, a feeling of pelvic pressure, increased nighttime urination, or general discomfort in the lower pelvic area. Naturally, this leads many people to search online for answers, and that is where misinformation spreads quickly because instead of medical explanations, they often find oversimplified or exaggerated claims. In reality, urology approaches this gland in a very structured way. We do not rely on internet terminology. We rely on symptoms, examination, and evidence-based assessment. What actually happens in a medical setting? When a patient visits a urologist with prostate-related concerns, the evaluation process is always guided by safety and necessity. A trained professional may perform a gentle clinical examination when appropriate, but only when there is a clear medical reason, under sterile conditions, using protective equipment, and with full patient consent and comfort in mind. The goal is never stimulation. The goal is always diagnosis. For example, a doctor may be checking for enlargement of the gland, signs of inflammation, tenderness that could indicate infection, or other structural changes that help guide treatment. Everything is done with precision and professionalism. And importantly, not every patient even requires a direct examination of the prostate. Modern urology often relies on blood tests, imaging, urine analysis, and symptom tracking. So the idea that this is a routine or necessary self-practice is simply incorrect. The biggest risk: misinformation and self-experimentation. One of the most concerning trends online is the idea that men can explore prostate-related techniques on their own based on unverified advice. This is where medical professionals become very clear. Self-experimentation in sensitive internal anatomy can lead to injury, irritation, infection risk if hygiene is not correct, and unnecessary anxiety from misinterpreting normal body responses. But beyond physical risk, there is a much bigger issue: misinterpretation of symptoms. Many men who try to self-diagnose or self-assess end up worrying about completely normal sensations or confusing them with medical problems. This leads to stress, overthinking, and sometimes avoidance of proper medical care. That is why urologists strongly emphasize if you are experiencing symptoms, the correct step is not experimentation, it is evaluation. What men should actually focus on. Instead of focusing on internet trends or DIY methods, men should focus on real indicators of prostate health. These include, are you urinating normally and comfortably? Have you noticed changes in flow strength? Are you waking up frequently at night to urinate? Do you feel persistent pelvic discomfort? Are there sudden changes in urinary habits? These are meaningful signals, and they are far more important than anything you will read online about techniques or procedures. Because in medicine, early awareness is what protects long-term health, not experimentation, not trends, but clarity and timely action. Why men often delay seeking help. One of the most common patterns I've seen in over 12 years of practice is delay. Men often wait because they feel embarrassed, they assume it's not serious, or they believe it will resolve on its own. But the truth is, most urological conditions are far easier to manage when addressed early, and most consultations are not dramatic or severe. They are simply informational. A man comes in with a concern. We evaluate it, we explain it, and in many cases we provide reassurance that everything is normal. So the real problem is not the condition itself, it is the delay in understanding it. If there is one thing I want you to take away from this, it is this. Your body is not something to fear, and it is not something to experiment on based on online information. It is something to understand properly through accurate medical guidance. The prostate is simply one part of a larger system that changes with age, lifestyle, and health factors. And when you understand it correctly, you remove fear and replace it with confidence. That is the goal of this channel, to give you clarity, not confusion. If you found this video helpful, make sure to subscribe to the channel. We break down sensitive men's health topics in a way that is simple, honest, and medically grounded without myths or misinformation. And in the next video, we will go deeper into a very common question. Why do urinary changes become more noticeable after 40? And when should you actually be concerned? I'll see you in the next one.